Hello, and thanks for joining us for Staffing Unplugged, a medical solutions podcast that delves into the world of staffing and recruitment. Each episode, we bring you insightful discussions, expert interviews, and thought provoking conversations with industry experts. I'm Kristen Dahl, your host, and I'm joined today by Patti Artley, Chief Clinical Officer and Chief Nursing Officer at Medical Solutions. Thanks for joining me today, Patti.
Thanks for having me, Kristen.
Can you start by telling us about your role at Medical Solutions and maybe a little bit about your journey into the healthcare staffing industry?
Sure. Well, my role, I'll start with that first, is Chief Clinical Officer, Chief Nursing Officer. And I'm really responsible for the quality of the clinicians that we share with our partners. Really making sure that our clinicians have the support that they need, as well as the clients have the support that they need. And I have multiple teams that help do that. I have a team of nurses that actually ensure that we interview and make the right placement. I have a team of credentialers that are responsible to make sure that each one of those individuals that we send on assignment are ready to practice in that area and are licensed and credentialed to do so. And then I have a quality team that really looks at our regulatory requirements, the state and federal requirements, and making sure that we're meeting all of those. So that's really about my role that I do now. And how I got involved in the staffing industry, my history is really all in healthcare. From the time that I started as a pediatrics has always been one of my focuses, and I started in that realm. And then I have evolved in leadership roles in the children's hospital space or women's space. And then my chief nurse really felt that I needed a more well-rounding. And one of the areas that I started to work in is I started a resource pool, worked with staffing and scheduling, and we purchased a scheduling system and then partnered with a software company. And so it really has evolved in there. And I did that again in another health system where we really worked to really streamline staffing and all of those things that really put nurses and other clinicians at the forefront and make sure that they have the tools that they need to do their job. And then I transitioned to staffing company in about 20 months ago.
Perfect. And I'm curious, Patty, in your time in nursing, I'm sure you've seen a lot of change. So, how do you feel right now about the industry overall? And what are you seeing in terms of workforce trends?
So I'd say we're in a state of influx. After the disruption that we have seen through COVID, I think we're really seeing a lot of innovation and a lot of things change. Sometimes what I am seeing in different areas is really recycling different things that we've done at different times in my career. I'm looking at care models that when I came out 38 years ago now, we're looking at a lot of those models being recycled and resurfaced at different areas of the country. I'm seeing scheduling practices that are evolving similar to what I've seen in the past. So I think that we are really looking at what is the best model of care now. What are the best ways to provide care to an ever-growing population and do it more efficiently? I think that's the part that everybody's trying to not just do it the way we've always done it, but really look at, do we utilize technology? Do we utilize different systems in a variety of ways so that we can get a different result? And when I think about probably those things that we're looking at, technology and systems, that's where I see the biggest change. When I look at how we're providing care in med-surg areas or in ICUs and remote facilities through virtual nursing, that's probably one of the more innovative areas that I think has just scratched the surface. We're just starting in that arena so that we're allowing nurses to practice differently, or we're allowing individuals to provide care in a different way. And so I think that's one of the areas that we're going to see more. I think we're going to see more innovation in the AI space. Right now, we leverage early warning systems, and that takes different data elements and puts together a warning for the nurse, either at the bedside or virtually, to really do something with. And it's hard in navigating an electronic medical record where you're constantly trying to figure out what data elements you're trying to put together, and some of them aren't as easy to find. These AI models actually allow us to alert the nurse or alert the clinician so that they can make the right decisions. So I think that we're going to see a lot more of those things happening, and a lot more of those will help us provide better care at the bedside.
A lot of really exciting things to come, it sounds like. Well, you also work with our healthcare clients as part of your position with Medical Solutions. You're really trying to make sure that they're successful in their staffing strategies, and you have a great connection with those who have their boots on the ground. Can you tell us, what are you seeing in terms of challenges? I know we've talked a lot about shortages and burnout over the last couple of years. Are those still the top challenges facing healthcare systems that you're currently working with?
So I think from an aggregate perspective, workforce is up the top five. I think that is contributed to the fact that there is burnout, and it's a constant in the forefront, which I honestly have to say that in 2019, if we surveyed what was part of a strategic plan, probably half of my colleagues would have said they're doing something around, the workforce support and burnout, and ensuring that people have the support that they need. Now it is probably amongst almost every one of our individual contributors. One of the things that I have seen that's different in the workforce is really around the technology that's in front of everybody. But it is a challenge because it's a costly investment. And when we're coming out of this, while we see a lot more of our partners who now have a margin, and they now have gotten out from behind some of those deficits that they've been in. And this is really an investment that they're trying to figure out, how do I make the kind of investments in technology that help support our teammates and help make their jobs smoother, because that's what actually contributes to the burnout. I think the big challenge for health systems is really how they provide value to the consumer, right? And that really means that we have high quality at a reasonable cost, and with salaries to make them a competitive market. They have consistently gone up since 2019. That makes it harder and harder. And when we think about the cost of supplies and the cost of technology, it's all gone up. So how to make the right decision for what they're investing in is a big contributor for most of our health centers, our health systems. And then when we talk about quality, we are doing a much better job in the quality of care, and patient satisfaction is starting to rebound as well, because we saw those fall for quite some time during COVID, and especially our nurse sensitive indicators, where we have seen falls increase, we saw pressure injuries increase, and now we're starting to get a control over central line and catheter related infections. So we're doing a little bit better. And I know that we're working on those falls and pressure injuries. So quality of care is still one of those things that individuals are always working towards.
And Patty, one of the things that we like to do on our podcast is really provide some insights, some actionable advice that people can take and apply to their own settings. So I'm curious as well, when you're visiting these facilities, working with leaders in small facilities and larger systems, What are you seeing in terms of new solutions and how people are adapting to the current reality when it comes to staffing challenges?
So I think the biggest thing that I see, we touched on it a little bit, is that virtual care. It's that integrated care models. They're trying different things so that they can make sure that individuals are supported. One of the things as we address burnout, nurse burnout, is really related to nurses being overstressed, overworked, and how they are able to provide care in a different way. So the integrated care models, whether they are introducing LPNs into the workforce, we have EICU, which is supporting a lot of our smaller facilities with their larger facilities oversight, and having a virtual nurse doing EICU or virtual nursing doing admissions and discharges and education, taking some of those tasks off of the nurse at the bedside, and really a collaboration that's taking place to provide care. I'm seeing in a lot of different ways. Um, Remote patient monitoring is another part of that virtual care, and how they are providing that in different facilities and in different ways, improving access to care through that virtual platform. I think is a big thing that has really taken off in the last several years. One of the other things that I'm seeing is leveraging technology. And one of the areas I never would have thought I would see in our facilities, the robots, and the number of robots that I'm seeing in some of these organizations that are really doing some of those tasks, whether they're, what the pharmacy technician was doing, and bringing medications to the floor, or collecting linens, or delivering supplies from a central supply space. It's really around how do we streamline the work, and at the same time making sure you're paying attention to the right things that will decrease the frustration, allowing individuals to practice to top a license so that they decrease burnout and decrease turnover.
That actually leads really nicely into my next question. I really wanted to talk to you today about top of license utilization. I feel like it's a topic I've seen in the news and also something that could be helpful to our listeners. So, Patty, can you explain why top of license utilization is so important?
Sure. Well, this actually is part of why nurses are burned out, right? So what top of license actually means is that you're utilizing your education and the training to your fullest potential, where you have individuals doing the things that they are trained to do, and not really doing all the other tasks that maybe others individuals could be doing that don't have the same education and training that the registered nurse might have, as an example. So it really has challenged us during this time to really look at our models and how we provide care differently. So when we think about what roles can help contribute to a nurse practicing to top of license, the LPN role, which we just spoke about, many hospitals are bringing back into the workforce, creates more of a team environment where you have a tech, an LPN, and a registered nurse. And each one of them has different things that they're responsible to do. And when we think about all the education that a registered nurse has, with 4 years of trying to put together what's the diagnosis, what are the contributing factors to some of the meds that I'm giving them, and side effects that I should be looking for, and what might be going on, that's really allowing them to practice to top of license. Whereas we probably don't need them to do some of the other things, like maybe feeding the patient care tech can take some of those responsibilities over, or giving them their bath, and making sure that they're ambulating and getting outside, or getting out of their bed and getting to the chair, and making sure that individuals each know their role and what they're responsible for. We spoke a little bit about that virtual nursing, and that's a model of really allowing nurses at the front line to do the things that we need the nurses at the front line to do. And they have a very busy schedule, and there's many days that they can't accomplish all the tasks, but by removing some of those things that they need a nurse to do, part of the assessment and the intake and the care planning and some of those things that the virtual nurse will remove from the frontline nurses' responsibilities. It allows them to practice to the top of their license and give the best experience because the nurse at the bedside is really focusing on the care that they're providing.
What are some of the things you're seeing as possible solutions or ways organizations and leaders are helping nurses best utilize their skills and expertise?
Yeah, similar to what we've been talking about. You really have to start by evaluating the way you're providing care. I think that each hospital and health system is going to come up with a different answer. And that's why I don't think there is a one size fits all kind of solution here. But it really allows us to think about all of the work that we've been doing over the last several years. What are some of the hallmarks, the infrastructures that have taken place and transitioned maybe differently in our own health systems? And then take that assessment, go back to the individuals who are providing the care, look at what some of your options are and validate what's most important to them. What is actually causing the challenge that they have in front of them? And then how are they able to look at things that are out there in the industry that can help decrease those frustrations and help eliminate the turnover? I really think that it is up to the leaders in the health system to really do their due diligence and go to the units, go to the shared governance, go to the individuals that are doing the work and understand the biggest frustrations. Then that's where you get started.
Looking forward, how do you see the focus on this top of license utilization evolving the future of nursing?
Yeah, I think top of license is going to be important for every organization. When you think about you have to be financially responsible, you really have to keep quality and access at the top of a driving force. So really, how do you provide care? Keeping all of those things intact is really important. And I really do believe that that top of license and making sure that when we have resource constraints, we know that there is a gap in what the supply and demand is for registered nurses. It's going to be so vitally important to be financially savvy and provide high quality care when the person needs it. So I think it is going to be more important now than it has been in the past several years, and that's why I think organizations that haven't started to really look at how they're providing care, and are individuals practicing to top of license will need to do that quickly in order to prevent the kind of turnover and burnout that we're seeing in our industry.
All great information. Patty, if anyone has any more questions about this topic, are there any good resources out there they can check out?
Sure. First, as we all know, nursing practice is really governed by your state. So know what your Nurse Practice Act is. I know that when I was going through my doctorate degree, I really wasn't up to speed on the Nurse Practice Act and what we were able to delegate and what we weren't. So it's really that responsibility for us to take a look and start there. And I think that gives you ideas about where do you have opportunities and where are there things in your own health system that might be different than what you could be providing. And I think that really helps drive us as your first opportunity. But the other areas, the American Nurses Association, American Organization for Nurse Leaders, any of the professional organizations. So if I'm running a labor and delivery, or I'm in a children's hospital or an operating area, those professional organizations actually are tremendous resources for top of license in those professional areas.
Excellent. Before we end today, I do have one more question for you. Being a nurse yourself and being in the industry for more than 35 years, what are you optimistic about or looking forward to seeing in the coming years in terms of nursing?
Well, I think I'm really excited. First of all, I've been a nurse this long. I can't imagine any other career, any other thing I'd like to do. But I'm very excited about where we're at and where we're going. This is an opportunity for us as a profession to really take a look at what we have been doing and what worked well and what are opportunities that we can embark on. What do we learn from other industries and how we can provide care in a very different way? I also think technology is advancing rather quickly, and I think this is an exciting time to be a nurse leader. I think this is an exciting time to be a nurse. There will be a lot of challenges, I think, as we move through the systems that we're moving through rather quickly, and a lot of trial and error. And I know that for some, that's scary, but I think this is an opportunity for us to embark on all new adventures and trial things differently than we've ever done them before. So I'm excited as to where we're going.
Great. That's a perfect note to end on. Thank you so much for joining us today, Patti, and sharing all of your knowledge with our listeners.
Thank you for having me.
Absolutely. And thank you to our listeners. Please join us every month as we unravel the complexities of healthcare staffing and recruitment, sharing expert insights and actionable advice that can help you with your staffing efforts. In the meantime, visit our website, medicalsolutions.com, for more information on our healthcare talent ecosystem and how we can help your facility reach its full potential. Thanks again, and we'll see you next time.